Good day on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel. I'm Dr. Dangleben, bringing you the medical topic of the day. Today I want to talk about sickle cell disease. Sickle cell disease, this one hits home, right? Because it's prevalent amongst us. And what is sickle cell? The words it's thrown around, and we know people who have it, family members, etc. But what is it? It's actually inherited. It's a blood disorder where your red cells, which is supposed to be concaved, kind of roundish, but take on a stiff crescent, thus the word sickle shape, right? And these sickle cells can block blood flow. They're more fragile and causes a range of medical problems. So how did this come about? And it's fascinating. I read this, a few years ago. The sickle cell gene mutation, thousands and thousands of years ago in Africa, all right, and the Middle East, all right, and they believe that it evolved as a protective trait against malaria, right? And we know the damage that malaria has done and continues to do, right? If you inherit one copy of the gene, it's called a sickle cell trait, right? And you don't get full sickle cell disease, right? And these people actually tend to be resistant to malaria. But if you inherit two copies of the gene, then you get sickle cell disease. So you get one from each parent. All right. So our genetic code really is its message, right? It tells us what to do and things like that, and the mutation in that gene causes that change in hemoglobin, which is the protein that carries oxygen in the red cell, right? And it changes the hemoglobin to a form that we call hemoglobin S. All right. I know this is basic science, but we have to understand these things. Just think S for sickle cell, right? And causes it to bend and shape into that sickle shape. All right. So there you have it in terms of the genetics. What are some of the signs and symptoms? Symptoms can occur as early as 5 months old, right, in children. So be cognizant in babies. Sorry, just be aware of these things, right? The sickle cell itself, the lifespan is 10 to 20 days, right? A normal red cell lasts 120 days. So just imagine such a huge difference, right? Symptoms like pain crisis, severe pain, and in the bones, the joints, the chest, the abdomen. And this is really caused by blocked blood flow, right? The swelling of the hands and feet, frequent infections, right? Your spleen slowly gets damaged, which is an immune organ that fights infection, right? And some of these patients have delayed growth and puberty, and a lot of vision problems, again, because of the blocked vessels in the eye. Severe complications, you get high blood pressure in the lungs, right? Pulmonary hypertension, stroke risk, again, all has to do with the blocked vessel, and end organ damage, whether it's the kidney, the liver, you can develop ulcers in the legs. A lot of times young folks get these ulcers in the legs, and the clinicians are looking and wondering what's going on, right? That should be a clue in the type of ulcer, should be a clue in that this patient could have sickle cell disease, right? There's a lot of research going on right now that's really looking positive, looking up for sickle cell, right? There is no cure right now, but there's a lot of things that we could do to relieve the symptoms, decrease the complication, right? I will put it out there, your dietary management. Keep hydrated, lifestyle, balanced diet, right? And avoid extreme temperatures, extreme heat and extreme cold. These things can affect sickle cell. If you're going to take a supplement, folic acid, supplement, right? Because healthy red cells really need folic acid. There's a whole slew of medications out there that can help. All right, some of them have side effects, so you have to read, hydroxyurea, glutamine, and several other new medication that that can help fight sickle cell. All right, Adakveo, which is a antibody type, a new medication, which is immunotherapy, is looking up in terms of decreasing the pain crisis and things like that, right? And again, since you're more prone to infection, keep up with the vaccinations. I know vaccines have gotten a hit in terms of reputation, but in terms of the pneumococcal, the meningococcal, and the flu, stay on top of that. All right. Take the antibiotics when prescribed because you don't want a simple infection to get into a severe infection. Keep in touch with your primary care and primary care docs. Keep in touch with the patients. If they need to see a hematologist, which is a blood specialist, please refer them. All right. Make sure you stay hydrated, as I said. Oxygen therapy is important because again, there's data coming out on hyperbaric oxygen and things like that. So there's a lot of things. But as I mentioned earlier, there's new developments. There's hope for the future. And it's all has to do with science. Stem cell transplant, right? All these things are being looked into. Gene therapy is being looked into, and new drugs are in trial, right? That's gonna, I think, really cure sickle cell. And that is what we hope for our people, because sickle cell disease is a serious one. It causes a lot of pain. It causes a lot of morbidity and mortality in young patients, and we would like to see a cure for this, right? So again, there is real hope for a cure in the future, and I hope it's in my lifetime, okay? Let's stay informed. Let's continue to educate each other. I'm Dr. Dangleben on behalf of Patient Choice. Have a great day. Peace.